There doesn't really seem to be one localized spot where it's all stemming from. Oftentimes we'll have one person in a household come in as positive. We then go over what their isolation is, but then identify the close contacts in the home. And more times than not, one family member will roll in, and somebody else, and somebody else. So there's a lot of spread within homes, especially, let's say, a young adult. They may have a sniffle one day when they wake up, and they don't attribute it to COVID right away, so that they're then going to work or going out to dinner with friends and socializing. And then while the whole time they actually have COVID and they're infecting other people. It's important for people to know if they're symptomatic, if they were identified as a close contact and they were to go get tested, they need to be patient for a few days and await those test results. If something we really like to stress to people is if you're awaiting test results, you need to stay home.
Someone in the family has been exposed outside of the home. The best thing for them to do is stay away from their family members. Wear a mask when you're in the common areas of the house. Just proactively stay away. Get tested 5 days after your exposure. So timing is everything when it comes to testing after exposure. If you test too soon, it will come up negative. Symptoms can be very, very mild. People we talk to are like, oh, I didn't even realize those were symptoms. I thought they were allergies, or I thought I had sinus infection. So I kind of want to go over the symptoms real quick. They can range from sore throat, runny nose, sinus congestion, fatigue, muscle aches, pains, mild fever, cough, shortness of breath. The telltale sign is loss of smell or taste. A lot of the more serious symptoms I would say to look out for, which might indicate you might need to seek more assistance, is shortness of breath. If you're having confusion, a new onset of confusion, if you have GI symptoms and they aren't resolving in a couple of days, bluish lips that's an emergency. You need to go to the doctor. That means you're not getting enough oxygen and you're compromised. Your respiratory is compromised.
And we always tell people if you're experiencing symptoms and you do need emergency help, call 911. But we always ask people, please, please, please be sure to tell them that you or somebody in your household is positive for COVID. Just that way they can then don the proper PPE and protect themselves, but also our residents. If you're symptomatic, whether it be if you're symptomatic or if you were exposed by a local board of health as being a close contact, what we recommend is for the person to call their primary care doctor, see if the doctor can put in an order to go get tested. Oftentimes, places are testing vehicles, so you don't get out, you don't go to an urgent care or things like that. You really just stay in your car, you pull up, you check in, the nurse will come out, swab you, and if it's a rapid, you stay in your car for about 15 minutes or so, and then you get your results. If people get a PCR test, which is what we would consider to be the quote-unquote gold standard, if you will, then after the test is administered, they drive away and you basically go back into isolation at home.
Post-exposure quarantine is important because you can be contagious with COVID 2 days before you even know that you're contagious, which is kind of a scary thing because you have people out there who don't have any symptoms. They don't know that they've been are contagious and they're going about their normal business. The contagious period lasts for about 10 days after you either have symptoms or test positive. So typically we start with the symptom date, that's day 0, and then we count 10 days out from there. On the 11th day, if you're feeling good and improved with no fever for 24 hours without using medication, then you're free to go from isolation. In some instances, it has been longer, but usually it's people are very severely ill and they end up going to the hospital and having much more of a complex case. But most people are generally better in 10 days. A myth is that you want to get tested again to see if you're negative, and you don't want to do that. Reason being is you can test positive for quite some time after having the virus. It doesn't mean that you're contagious. It just means that you're actively shedding some viral particles that can be detected in a test tube.
Oftentimes after somebody is released from their isolation from a public health perspective, what we do is we then write them a letter clearing them in order to resume normal activities. Because of the fact that the guidance changes so quickly, a lot of the times employers don't know that. They can't say you need to get a negative test in order to return to work, things of that nature. Again, it's very fluid. The guidance changes often. So in a situation like that, I know that we've spoken to multiple businesses just to educate them.
This virus is spread by droplets, And if a droplet gets caught by a mask, it's not gonna make it as easy to travel to someone else. So masks, social distancing works. Keep your bubble small. Stay home if you don't feel well. If you have questions, call us. The Board of Health is always willing to talk. Take the precautions. It's not going to hurt anyone to be more cautious and say, you know what, I kind of have a sore throat. I should stay home today, see how I do. And of course, if it gets worse, you go get tested. Your doctor is probably the best person to turn to kind of talk you through whether you should get tested or not, depending on your outside exposures and some of your symptoms that you're having. But I always say err on the side of caution. We're still in the very early planning stages for the vaccine rollout. We know that Chelmsford's going to be getting cases to distribute among the population. We know that we're going to be able to host some clinics for some of the general population that has comorbidities and eventually everyone.
We encourage folks to quote unquote like the Chelmsford Board of Health Facebook page, and we'll be sure to post any updates, flyers, schedules, things of that nature on that social media.